Alright, so we're going to draw the brachial plexus, and we're going to do this in a quick and easy way so that way you can have this for test day. So the brachial plexus is made up of spinal segments C5 through T1, which we have drawn here, and now we're going to go ahead and start drawing this out. So C5 and C6 spinal roots are going to come together just like C8 and T1. I like to draw those all the way out off the initial bounce. I'm going to show posterior fibers in blue here, so we're going to do that with C7. And then go ahead and label the different components of the brachial plexus. We have the roots, then we're going to have the trunks, we're going to go to divisions, then we're going to have cords, and lastly we're going to have terminal branches. So we'll talk about each one of these as we go. Now off of the C5 and C6 roots, we are going to have the dorsal scapular artery coming off, dorsal scapular nerve. The long thoracic is going to come off and get contributions from C5, C6, as well as C7 here. And those are the two nerves that come off of the roots of the brachial plexus. Next, we go to the trunks. We're going to have our suprascapular, as well as our nerve subclavian. Those are coming off of that superior trunk there. Next, we're going to get into our divisions, and usually I draw this right off the beginning, but we're going to have a component of the C5 and C6 coming to join C7, as well as C8 and T1 are going to give a contribution, join C7 as well. And then we're also going to have one final contribution coming from C7 going up to that superior cord. And so now we have our divisions here. We're going to have anterior and posterior divisions. Anterior divisions are in yellow, posterior division is in blue. That is in relation to the axillary artery. Next, as we go to our cords, we're going to have some additional branching that we're going to need to keep up with. So off of our cords, we have our superior cord. This is going to have the lateral pectoral nerve. And then our inferior cord down here at the bottom, this is going to have our medial pectoral nerve. It's also going to have our medial brachial cutaneous, as well as our medial antebrachial cutaneous. And we'll go back to and label all these at the end. Now, coming off of the posterior cord, we're going to have the upper subscapular nerve, we're going to have the thoracodorsal nerve, and the lower subscapular nerve. And that's going to be all the branches that we need to know for our cords. Now, lastly, when we get to our terminal divisions, these anterior divisions are going to give off a cord that comes together. It's going to come off to a terminal branch. That's going to be our median nerve. And then our posterior cord is going to branch into two nerves, one of which is going to be our axillary, and the next is going to be our radial. So one way to remember this, so as we go through, we have musculocutaneous on the top. We have axillary next. Then we have radial, median, and ulnar. And one way to remember this is the mnemonic MARMU, the well. So one more time, this is musculocutaneous, axillary, radial, median, and ulnar nerves. And those are going to be your terminal branches that you're going to follow into the arm. Now, going back through and labeling all this one more time, off of the C5 spinal root, we are going to have the dorsal scapular nerve. C5, C6, and C7 contribute to the long thoracic nerve, which innervates the serratus anterior muscle. Off of the contributions from C5 and C6 coming off of that upper trunk, you're going to have the nerve to subclavius, as well as the suprascapular nerve. And that takes us all the way to our cords. We're off of that superior cord. We're going to have the lateral pectoral nerve, which is innervating both the pec major and pec minor muscle. We come down to our inferior cord. We have the medial pectoral nerve, which is innervating the pec major muscle. We have the medial brachial cutaneous, which is doing skin over the brachium or the upper arm. Then we're going to have our medial antebrachial cutaneous, which is doing skin along the anterior forearm. And then as we look at our posterior cord, we're going to have our upper subscapular nerve. This is going to be paired with our lower subscap. And then right in between, you're going to have the thoracodorsal, which is going to be going and innervating the latissimus dorsi, running with the thoracodorsal artery. Okay, so with that, that is how we quickly draw the brachial plexus. And once you get good at this, you can draw this in less than 30 seconds. And it's a really good way to kind of orient yourself for making sure you can remember all of the spinal segments as well as all the nerves that you're going to need to know.